on Monday. I'll see you in our. One of the others.
present to all of you, the residents and fellows. It's not, oh, hold on. Nope. We need help. No, it doesn't work anymore. It I touched something. No, this is for them, right? Yeah, but this. No, it's not working. It was working before. Is it here? Yeah. Technical. No, I think the blue light is them.
Oh, it's them.
So is there another switch? What happened? All right, better. Now, all right. All right, we'll start again. Good afternoon, everyone. It is an honor for me to present to all of you the residents and fellows of the Brooklyn Hospital class of 2022. Congratulations. I would like to welcome the family and friends of the graduates who are watching us via our YouTube link and thank them for their support throughout their time that made today's graduation possible. Please join me in applauding the hard work, dedication, and achievements of our class of 2022 who are graduating today and have survived a pandemic, helped us through it, and they persevered through it. So thank you and congratulations. Next, I'd like to get a round of applause for all the TBAC physicians and staff who helped all the residents and fellows throughout their years here. So I would like to welcome our chair of our Board of Trustees, Lizanne Fontaine, members of our Board of Trustees, our President and CEO, Mr. Gary Terinoni, our Executive Vice President and Chief Medical Officer, Dr. Vasanta Kandamudi, senior management members, department chairs, program directors, associate program directors, assistant program directors, faculty, residency and fellowship coordinators, and my GME team to this special event. Next, I would like to invite Mr. Gary Terinoni to say a few words to the graduating class.
Thank you, Armand. Can you hear me? Okay. I'd just like to congratulate the graduating class for a fantastic job. I've been to 2 parties so far, so I'm trying to compare which party was a little nicer. But anyway, no, it's been great. And you know, I've heard people talk about the last couple of years. I've tried not to focus on it too much at the party comments, but you know, when you think about the experiences that we've been through, it's kind of hard to believe, right? What the last 2 years have meant to this hospital and to the community that we served. So as I think about it relative to your experiences, not that you want to go through something like that, but clearly you've all been battle tested, right? And you know, I've been interviewed a few times about what we went through, and I correlate it to like being in the military, right? This has been my career, almost 40 years, probably more, that I've been doing this. And what you think about is, you know, when you decide what profession you want to get into, you kind of associate that with, okay, when your time comes and you're called. So I know my father was in World War II for 5 years, you know, and a lot of uncles and so forth, and fought in Normandy and D-Day. So I guess they had no choice. Maybe they were drafted, but clearly when it was time for them to serve, they served, and they served valiantly. And I'd associate that the same thing with healthcare. You know, when I got into healthcare at a relatively young age, it was always in my mind that whatever was called upon, that you know, you would do. And so I never expected to be called upon like we were the last couple of years, but then it was like being in the military. It was our time to shine, and I think you all exemplify that to a T. So Well, it's not good probably to have that experience at your young ages, but in a way, in an odd way, it does make you more battle tested. So it's maybe something that we even have to get used to in the future with more of these diseases and the pandemics and so forth, so that it's just the way we have to think about in the future. And I've been reading a lot about the workforce, right, and how we have to look at the workforce. But look at how much that has changed. You know, if it wasn't for the hospital, you know, we came in every day. Never thought about working from home. But a lot of the industries now, I think the perception is, can we do the work from home? Unfortunately, unless you're doing telemedicine, you probably won't have that opportunity to do much of that. So it's interesting. So we really like to thank all of you and your families. I'd like to thank Armand and as the DIO and the program directors and the APDs, because you know you've all done a great job. And really going to these parties kind of gives me, first of all, it was kind of neat because I'd like to hear, and I assume we might do it today, but I'd like to hear where all of you are going, you know, like just, it's kind of amazing to me. We've tried to elevate the game, you know, the last few years since I've been here, which is about 6 or 7 years, in terms of even our acceptance criteria of even, you know, coming to the programs. So I think you're a reflection of that improved recruitment. And we can see it when we look at the fellowships and the jobs that you all are getting and the institutions that you're relating to. So, you know, I live outside of Philly, and I have a home outside of Philly, and I was at Mainline Health for something, one of my doctors, and I forget what, he goes, do you mind if I, you know, bring in one of the residents, or I think was rotating, but they were very familiar with Armand, actually, and very familiar with our program. I think they had even been through our program or rotated through. So, and Jefferson that was part of Mainline at the time, is one of the top 20 hospitals or systems in the country. So it's amazing the reach that you all have. And quite frankly, it's not really about where you come from either. You know, they make a lot about, well, you know, the schools, whether it's Ivy League, not Ivy League, you know, I tend not to focus on that too much. It's really about you as an individual. It's about your skills. It's about your value system. It's about you. It's about your families, the way that you were raised. And that's really what's more important. And you know, I credit my parents to a lot. If I've had any success in business or in healthcare, it's because of the value systems that they taught me. And I am telling the people at the party, because this is kind of what worked for me, right? You kind of get out of school, you go to college, you take a subject or whatever your direction is. You never know really where that's going to end up 20, 30 years from then, right? And so what I tried to do is always think in increments of 5 years. You know, what are my goals within the next 5 years? Because I didn't know how much I had in me in terms of even what my skill set was or what my knowledge base. I was lucky because I had a great number of mentors like you all have that kind of, in a way, taught me how to think or taught me how to approach problems. And that makes a big difference. So hopefully you've garnered from your leaders here and your teachers, you've garnered that. But the one thing hopefully they convey too, but I think this is more innate in all of us, and maybe it's from your parents, the way you were raised, it's your value system in terms of doing things the right way. You never take a shortcut. You know, what you want to do, you're going to be confronted with issues in life that you can go the easy way, and maybe it's not so the right way, but you know, you look at the right way and it's a little bit harder, or maybe it seems disappointing to you because the other way seems like better for you at the moment. But I can tell you what you need to do is be steady in your decisions, and if you're committed, you have to be committed to doing the right thing. So just because someone, you know, tells you, well, these people do it that way, or you know, you have to listen to yourself, and you have to make, you know, common sense of things and do the right thing. So again, you know, it's been a long road for me, but what I did is 5-year increments, and then whatever talents I was given or I felt that I had, that's what really drove me to the next step, to say, well, you know what, I think I could do that too. And I assume if I didn't think I could do it, I wouldn't have done it. But it's that push, though. The other thing is, I was being pushed by myself to do more and to excel at what I wanted to do. But it was never tough for me. Why? Because I really liked what I was doing. So to me, I was just using what I would call God-given talents to really drive me where I wanted to go. And I think if you do that, it's not about money. It's not about that. It's really just about how you feel about yourself. And success, you could look at success and think of it so many ways. But, I do think it's values. I think there's nothing wrong with achieving, material things if that's what you want, because you work hard for it. I think that's the key. You work hard, but you get out of it. So when I was younger, I worked hard at what I did when I was young, and maybe I wasn't maybe the smartest person in the room, but I could outwork the people in the room. And to some degree, that created an ability for me to be smarter than most when I got older, because I took a lot of that hard work in. It just makes you smarter by having those experiences. So anyway, those are my comments, and I wish you the best of luck. I'd like to thank your families if they're on YouTube or whatever, because they're probably a big reason as to why you're here today. So I congratulate them, I congratulate you, and I just have to remind you, just don't forget about us. We're doing some really good things here at the Brooklyn Hospital. You might not be as connected to administration as you would normally be because you're being doctors, right? So we don't expect you to do that. But that we're doing a lot of things behind the scenes to really elevate the game at the Brooklyn Hospital Center. And you could see that in some of the accolades that we're getting, whether it's health grades, whether it's leapfrog score, which we have one of the top hospitals in Brooklyn in terms of quality and safety. So, but that's what all hard work, that's what focus gives you. So again, I'd like to thank Armand and the team, and congratulations again, and good luck. And don't ever forget about the Brooklyn Hospital Center. Thank you so much.
Thank you, Mr. Terranoni. So next, I'd like to introduce Dr. Joseph Heaton, our house staff president. So he is presently graduating from the Internal Medicine Department. Joseph is an Eagle Scout. He's a trustee and firefighter for the Farmingdale Fire Department in New Jersey. In addition, he obtained a Master's of Biomedical Science from Rutgers, followed by an MBA in Healthcare Management from Capella University. He then joined St. George's University and obtained an MD with honors in 2019. He joined us after that, and he's graduating today. He will be going to Jersey Shore University Medical Center as a full-time attending in the Department of Internal Medicine. During his time at TBHC, he has authored multiple articles, and he has had multiple successful podium presentations. In his latest role as house staff president, he's performed an outstanding job. He was a strong resident advocate who worked closely with myself and with my office, and he participated actively on multiple committees. I would like to congratulate Dr. Heaton for all his hard work, dedication, and successes while at TBHC, and wish him lots of luck in his future endeavors. Joseph. Congratulations.
Hello, everybody. I'm Joseph Heaton, president of House Staff. It's my honor to stand up here and congratulate everyone on finishing their respective residencies and fellowships. First, to our friends and family, thank you for being by our sides over the past few years. Graduate medical education is a grueling road filled with long hours and stressful days. You have bared this burden alongside us, spending countless hours alone. continuing on with life's challenges and tribulations, all while supporting us. We cannot thank you enough for all that you have done to sacrifice on our behalf. To the graduating residents and fellows, wow, we made it. Years of studying, undergraduate education, in medical, podiatry, pharmacy, or dental school, graduate medical education, and now here we are. Many of us started our graduate medical education green behind the ears, trying to find our way around the hospital, figuring out the computer system, and placing countless IV lines. The more we learned, the more we realized there's more to know. Hours upon hours, days upon days, we would grind through our shifts, doing the best for our patients, sacrificing our sleep in the pursuit. We knew it was hard, but like many before us, we would find our way through. And then one day, business as usual was no more. The COVID pandemic hit us like a freight train. We were isolated, overwhelmed, redeployed, and then faced an invisible threat with unfathomable lack of resources. We worked hard. We saw our families less. We called countless families to report sad news. We felt helpless in an uphill fight, and all while wondering if we would be infected next. It was a long, torturous road, riddled with waves, but we never gave up. We improvised, we acclimated, we got through it. As with all storms, this too has begun to pass. The sun has already started to shine through, and we are advancing forward again. It was your hard work and perseverance that carried you through. Remember this, as life will always have challenges, but if you can overcome that, you can overcome everything. Never forget how strong you are and the heights you can reach. So to end on a high note, I want to again congratulate everyone on all the hard work. You've made it through Brooklyn Hospital and have made Brooklyn Hospital a better place. You have improved the healthcare of so many that need it the most. Be proud of what you have contributed. Be proud of what you have accomplished. And as you go on in your career, remember the opportunity afforded to you here, and never let the chain end with you.
Thank you, Dr. Heaton. So, in addition to all the hard work, there's lots of research that goes on at Brooklyn Hospital. And we always have a competition in the spring of each year. And I would like to announce the winners of the Vincent Tricomi Awards. The first prize goes along with a $300 gift certificate, the second prize $200, and the third prize $100. I will try to pronounce the names as well as possible, but I'm not Dolores. So. First prize goes to John Sorenzio, from second-year pharmacy resident, for the effect of a single-dose aminoglycoside with a beta-lactam for the treatment of gram-negative bacteremia. Congratulations. Second prize goes to Racha Patki, third-year pediatrics resident. Evaluation of pediatric chest pain in the ED. Is there a paradigm shift post-COVID-19? Third prize, Joseph Heaton, third-year internal medicine and resident and house staff resident. Impact of frailty on outcomes in acute ST-elevated MIs and percutaneous coronary intervention. Congratulations. So next, we're going to introduce the chairs of each department. And I'll invite each chair, and then each chair will say a few words and invite the program directors and so on. So we will start with Dr. Dim, Chair of OMFS and Dentistry.
Good afternoon. I join with all the other speakers on this day in offering the 2022 graduating class of the Brooklyn Hospital Center residents my heartfelt expression of thanks and good wishes for a job well done, with a special acknowledgement to those listening in on YouTube or Zoom for the years of sacrifice and support of their families. I would be remiss if I were not to publicly acknowledge Ms. Lizanne Fontaine, Chairperson of the Board of the Brooklyn Hospital Center, along with Mr. Gary Terranoni, Chief Executive Officer and President of the Brooklyn Hospital Center, Dr. Vicente Condamuti, Chief Medical Officer and Executive Vice President, along with the other senior members of the administration team, for their extraordinary work this year in guiding the Brooklyn Hospital Center through difficult financial waters brought upon by the COVID pandemic. Their ongoing commitment to providing a stable, high-quality community hospital along with a high-quality residency education is truly exemplary. I am pleased to publicly also thank and acknowledge the members of my department, the Dental and Oral Maxillofacial Surgery Department, for their continuing commitment to high-level education and to making our residencies both in general practice and oral surgery one of the best in the country. Much thanks and kudos to Dr. Boyce, my Vice Chairman and Program Director for the General Practice Residency Program, Dr. Earl Clarkson, our most senior oral and maxillofacial surgeon, Dr. Edward Woodbine, Dr. Michael Chan, Dr. Jared Miller, Dr. William Perez, Dr. Shreer Wiesel, Dr. Saad Butt, Dr. Mark Sadowski, Dr. Rena Clarkson, and Dr. Gary Clemens for their outstanding loyalty and commitment to the Brooklyn Hospital Center. We are truly fortunate to have these high-qualified, highly dedicated individuals working with our residents. Much thanks to Dr. Asarian, Ms. Dolores Mendez, and Ms. Nancy Jamie from the Graduate Medical Educational Department for their help throughout the year. And finally, my sincerest words of appreciation to my most loyal and dedicated executive assistant and residency program coordinator, Ms. Gloria Stallings. Special acknowledgement, of course, to Ms. Sandra Conti, Javier Velez, and Lucy Moran Pichardo, and my entire staff of dental office assistants for making our department a center of excellence in the institution and for the community. In keeping with most graduation speakers who offer unsolicited advice and opinions, I will now present mine. Burnout syndrome is most often seen in demanding jobs and in people who care for others, such as physicians. Due to the high level of stress brought upon by the constant specter of malpractice that lurks behind every medical decision and every constant oversight and second-guessing by regulatory agencies such as the DOH, the CMS, Joint Commission, internal peer review committees, coupled with the emotional exhaustion of working with sometimes unreasonably demanding patients, the 2022 graduates worked through the height of the COVID pandemic and were on the front lines, with many residents falling seriously ill to the virus, and some ending up on the front page of the New York Times, which in fact happened to one of my senior residents. While others secluded themselves behind locked doors in their home offices, you all marched steadfast into the line of fire. You all went from being unsung heroes to sung heroes, being serenaded at 7 p.m. with community people standing and cheering in the streets and on the fire escapes back to being unsung. Such a roller coaster ride can be unsettling and upsetting. This post-pandemic period is now business as usual, with many taking your dedication and sacrifice for granted, very similar to the immediate post-9/11 period, which unified America, in that every state of the Union was a red, blue, and white state, and now a polarized, divided country of only red and blue states. So take care of yourselves. Burnout is real. Lean on your families and friends for emotional support. Eat right, exercise, and know that the clapping and appreciation is still out there, but it is muted and faint amidst the cacophony of everyday life. And the clapping can only be heard when the streets grow quiet and people retreat to seclusion during pandemic times. As always, my final words of advice to the graduating class of 2022: never prescribe a patient both a sedative and a laxative simultaneously. I'd like to now introduce my three graduating residents. Dr. Nabil Musa, who is here. Are you supposed to come up here? Yes, okay. Dr. Nabil, outstanding resident, who will be joining a private practice of oral maxillofacial surgery with Dr. Edward Ziebowitz and doing a fellowship at the Anne Arundel Hospital in Annapolis, Maryland with Dr. Edward Ziebowitz, which is a hospital which we are currently affiliated with, and we will still be working with Dr. Nabil Musa. Dr. Ichio Fan, who is here today. He did outstanding work. He was with us for 5 years. He'll be joining a private practice in oral maxillofacial surgery in Flushing, New York. And we hope he will become a voluntary OMS attending here at the Brooklyn Hospital Center. And finally, Dr. Yoav Nudel, who is in Geisinger Medical Center in Pennsylvania currently, and he will be joining a practice of oral maxillofacial surgery from one of my residents who graduated in 1990. So it's gone first circle, and we want to thank him and congratulate him as well. Thank you and congratulations.
Dr. Boyce?
Good afternoon, Mr. Terranoni, Ms. Fontaine, Dr. Kandamudi, Dr. Osarian, members of administration, members of the Board of Trustees, chairwomen and chairmen, program directors, and attendings. I would like to thank Almighty God for bringing us together again at Long Island University and for guiding me and my colleagues to another successful year. First, I would like to thank Dr. Dim for your continued support for the GPR program. I still marvel at the working friendship that God has allowed us to have while teaching and training the next generation of dentists. I would like to thank Ms. Gloria Stallings, our GPR and oral and maxillofacial surgery program coordinator, for your presence and strength. Gloria is priceless to the foundation and maturation of both of these programs. Gloria, please wave your hand so everybody can know who you are. I'd like to thank Ms. Dolores Mendez, Nancy Jamie, and the other GME staff for all your continued help and support over the years. Special thanks to all of the attendings on general dentistry, Dr. William Perez, the Assistant Program Director, who is not here today, Dr. Gary Clemens, Dr. Rena Clarkson, Dr. Sharon Wiesel, Dr. Saad Butt, as well as the oral surgery attendings, Dr. Earl Clarkson, Dr. Michael Chan, Dr. Edward Woodbine. Also a special thanks really to our support staff, our administration, receptionists, and dental assistants for their help and support. I cannot think of a better gift than the ability to bring healing to the human body, for in doing so, you uplift the human spirit. With this, I also like to give a special thanks to our fine oral surgery team who treats the infections of the head and neck, handles the trauma, and the reconstructive surgeries for the department. I would personally like to thank my residents for helping me and our staff to improve the overall oral hygiene, if you will, periodontal, endodontic, restorative, prosthodontic services to the people of Brooklyn. I will always remember, I want you to always remember, we are the members of the healthcare team that is responsible for the beautiful smiles of Brooklyn. I pushed you to be great, and you stepped up every time. It was a pleasure teaching you, and I hope that you enjoy your time acquiring new skills, acquiring the new skills, knowledge, and providing quality services here to our Brooklyn community in the dental and oral surgery clinics as well as the operating room. I wish you the very best of success in your future endeavors. At this time, I'd like to introduce to you my residents in alphabetical order. An alumna of the Medical University of South Carolina, Dr. Shika Amin. She will go into private practice in South Carolina. An alumnus of Touro College of Dental Medicine, Dr. Makan Del Rahim Nia. He will go into private practice in New York City. An alumna of Tufts University, Dr. Sheena Jain. She will go into private practice in Florida. An alumnus of New York University College of Dentistry, Dr. Mohit Kataria. He will go into private practice in Georgia. An alumnus of the University of Maryland, Dr. Gabriel Rakowski. He will go into private practice in New York City for one more year and then pursue a specialty in orthodontics. An alumnus of Touro College of Dental Medicine, Dr. Roman Cerniak. He will go into private practice in New York City. Special thanks to our chief residents, Dr. Yijo Fan, Dr. Nabil Musa, and Dr. Yoav Nudel. Thank you for your leadership and support over the years, and I wish you also success in your future endeavors. Help me to welcome and honor the 2022 general practice and oral and maxillofacial surgery residents. Thank you.
Next, our Chair of Family Medicine, Dr. Shirley Abraham.
Good afternoon, everyone. Can you hear me? Good afternoon, everyone. To our CEO, Mr. Terranoni, CMO, Dr. Kandamudi, our DIO, Dr. Sarian, the administration team, to my fellow chairs, program directors, residents, families, and friends who are watching online. I thank you for your support to the Family Medicine Department. I am delighted to be here today as chair of Family Medicine Department to congratulate and talk about each of our residents. Briefly, I would have Dr. Rivero come up now, along with Dalia, our coordinator. Please join us. Our APD, Dr. Ehrlich, was not able to join us as she's sick with her entire family at home. We do have a diverse group of residents who have a unique set of skills and are from different countries. So allow me to talk about each one just for a few seconds. Our first one up is our upstate skater, Dr. Puya Rastami, who is Iranian in origin, who walks around like long-haired Jesus, walking on water, on a skateboard. He has sprained multiple parts of his body. The only resident who went to the emergency room for hurting his ankle on his skateboard, and his note says, the resident attended family medicine conference on Wednesday in spite of his sprained ankle. Now that's what we call great documentation for billing purposes. Kudos to our ED team. Next up is our resident, 4'9", Dr. Karissa Brown. Cute and lovely, like a little chihuahua on the outside, but really a pit bull on the inside. It's been heard that her little foot can stomp hard. She is not afraid to speak up and is always ready to defend her team. She's an efficient worker and absolutely a pleasure to work with. She's very helpful during the Leapfrog survey. We also do have our own fashionista, Dr. Karandeep Thandi, who's not only gorgeous, but smart and talented. She's knowledgeable and very well informed. I happened to sit on one of the sign-outs, and it was quite impressive that she knew all the patients on the team, not just hers. Next one up, we have Dr. Krishna Lalu. What can I say? He's Guyanese by origin, and still very true to his culture. He's a true colleague and an amazing friend who always happens to talk a lot about his GI issues. One lunch break with him, I regretted buying him lunch that day. Alas, it was pizza for a lactose intolerant resident. We cannot always forget our La Prov Center residents, Tito and Michael. El Dominicano, Tito, is how the lovely Hispanic ladies call him. I had the pleasure of working with both the residents while covering La Prov for the last few months. Dr. Tito Joaquin is an old, wise soul. He's definitely calming, distilled for the last 3 years, highly adaptable, aged well, and very versatile spirit. I know he'll be a delight wherever he goes. We also have our Ecuadorian teddy bear, Dr. Michael Herrera. He's a phenomenal physician, a remarkable teammate, and at his interview, we talked about his hobbies, which included his expanding newfound Ecuadorian cooking skills and video gaming. So I looked up a study. The study published in the Journal of Translational Medicine showed that video games can be therapeutic and have very health-related benefits. The report also stated that video games can be used for muscular strength. I guess his Ecuadorian cooking skills expanded and outweighed his health benefits and muscular strength there. He's very thorough and loved by his patients. And last up is our chief resident, the Canadian, Dr. Stephanie Baptista. There's something quiet and confident about this elegant young lady. She's stunning both on the inside and outside. She's thoroughly dedicated to everything she does, and she's still single, by the way, and I've been trying to matchmake for the past 3 years. Congratulations to all the graduating residents, and God bless. Do not forget us, and do not forget your home. Now I invite our program director, Dr. Rivero, to come up and give her remarks.
Good, it's for short people. Can you hear me? Yes? Okay. Good afternoon, Mr. Terrignoni, Dr. Condamuri, members of the Brooklyn Hospital Center Administration, Dr. Aserian, and the GME staff. We thank you for honoring our graduates today in this ceremony. To the parents and family watching online, thank you, Dr. Abraham and Dalia, for being the pillars of this family. To the family medicine, it doesn't bend. Final hold. To the family medicine class of 2022. Traditionally, graduation speeches are all about congratulating the graduates and praising them on how hard they work to achieve their goals. But this is a class of millennials, a generation often described as self-entitled and having unrealistic work expectations. So I decided to spin it a bit. I want to ask you, the graduates, to dedicate this day to the practice of gratitude. Modern neuroscience shows that the cultivation of gratitude also helps us to become more mindful of the life around us and what circumstances are we in. But what is gratitude? It's a strong feeling of appreciation to someone or something. How do we do that, Dr. Rivero? We're not used to do so. So don't worry, I'll help you. First, I want you to tell your parents, family, and friends how honored you are to have them, how grateful you are for their care and support over the years. Thank them for instilling you with a strong passion for learning and for doing everything possible to put you on the path of greatness. You wouldn't have made it through med school and family medicine residency without them. Be appreciative of your patients, them, the human in a vulnerable position that allows someone in training to be involved in decisions on their most valuable asset, their health. Remember, they chose to give you the opportunity to learn and sometimes to even make mistakes. You have few days left to say thank you and goodbye. I assure you it will fill your heart with love and good memories. Now, I want you to remember how you felt when you were applying to the match, how anxious you were, the uncertainty that we all have on that chapter of our careers. There are 745 family medicine programs in this country. How many did you apply for? How many gave you interviews? Just to put it in perspective, on the year that you apply, this 29-year-old family medicine program received 2,483 applications, and the 7 of you made it. Appreciate this 177 years old hospital that, although it's not perfect, gave you the experience to practice anywhere in the world. Say thanks to the staff and the faculty that guided you and helped you get the knowledge to practice family medicine and so much more. I encourage you to start seeing life with gratitude if you're not doing so already. Congratulations to the family medicine class of 2022. We present our 7 graduates now. Dr. Stephanie Batista. Dr. Karissa Brown.
Congratulations.
One, two, three.
Dr. Michael Herrera, sorry.
Congratulations.
Thank you. One, two, three.
Dr. Tito Joaquin.
Congratulations.
Thank you, Sarah.
Dr. Krishna Lalu.
2, 3.
Congratulations.
Thank you, Dr. Sarah. 1, 2, 3.
Dr. Puya Rostami.
Congratulations.
All right. Beautiful. 1, 2, 3.
And Dr. Karandeep Tandy.
Congratulations.
Thank you, Dr. Sorenzio.
Beautiful. 1, 2, 3.
Thank you. Next, for the Department of OBGYN, Dr. Errol Meyer, Chair and Program Director.
Hello, everyone. Good afternoon, all, and welcome to the graduates. Welcome, Mr. Terranoni, our CEO and President, Dr. Vasanta Kandamudi, our Chief Medical Officer, Chief Nursing Officer, Judy McLaughlin, invited guests, Dr. Ansarian, and all of our honorees. It's a pleasure to be here today to celebrate the accomplishment of all of you graduates for your great work throughout the years. I'm especially honored to congratulate my residents for their dedication and commitment not only to the Brooklyn Hospital, but to our specialty, OBGYN. The journey you took to get to this day was not always smooth, had some rocks and turns in it, but you persevered, and you're here today. Obstetrics and Gynecology residency program, while it's quite rewarding, also is time consuming. A lot of sleepless nights, a lot of time away from family. Unfortunately, I can't tell you it's going to change anytime soon. So while you graduate and move on into attendanthood, you'll still be logging long hours away from family and friends. But we get the reward of treating patients and offering high quality care. While our residents are each unique with their own personalities and characteristics, some with type A personalities, some very nurturing, some humble, some outgoing. They all share a common quality and qualities of compassion, dedication, and commitment to providing outstanding care to our patients. During the height of COVID, we had many trying times and hardships, but everyone rose fearlessly to the challenge and continued to provide high quality care to our patients and in turn to their families. As I've mentioned before, you've logged many hours, working nights and weekends on labor and delivery, in the operating room where you called me to say, oh, Dr. Meyer, we've just finished the case at midnight, we'll be in a little late tomorrow, and in your continuity clinics. Missing, as we all do, many events, but I promise what you have learned during these 4 years are going to lay a strong foundation and will be invaluable to you as your careers progress. I have many residents or former residents who call me all the time. It's usually after a very difficult case to thank me for all of the diversity of patients that we've treated here at the hospital, which helped them get through difficult surgeries and taking care of complex patients. You too will be calling me someday. I would be remiss if I didn't thank your families who have entrusted us with your education, and I salute them for raising such great individuals and supporting your dreams. I'm sure without their support that your accomplishments would be nearly impossible. I would also like to thank my associate PD, my departmental administrator, my program coordinator, my section chiefs, faculty, residents, and nurses for their continued work and hard work and dedication, which allowed us to continually and successfully educate residents throughout the years. I challenge our graduates to go forward and have a positive impact on the healthcare system. Being from a safety net hospital, especially focused on health equity and trying to close our disparities that we face in our healthcare system. Remember, you always have a home at the Brooklyn Hospital Center, and we look forward to sharing your successes with you. So I will bring it down one by one, starting with Dr. Almar Cohen, who will be joining a large OBGYN practice in the Berkshires. Next, Dr. Courtney Pryor, who will be going back home to join OBGYN practice in Florida. Last but not least, Dr. Holly Quinn, that's the type A personality that we talked about, who will be going back to California to join faculty practice. That's our 2022 OBGYN residency graduates.
Next, for the Department of Pediatrics, the chair, Dr. Noah Kandamudi.
Vertically challenged people should get the mic out so people can hear you. This is a day we often look forward to. It's one of the most satisfying days personally for me, and I'm sure when I say that, it's the same for our program director, whom I'll call in, Louis Crowder, if you can join me, as well as Mino Valentine, please. Is Janelle Farnell here? If she is there, please. And Daniel Hunt, who was the program coordinator when Janelle was away. To all the dignitaries here, Chair, Board of Trustees, Nan Fontaine, Mr. Terranoni, CEO and President Vasanta Kondamudi, EVP, and Judy. Armand, first of all, great job, your team, putting this day together. Great, fantastic atmosphere here. So my first thing is I want to keep my sermon very brief, because a long sermon is like acute tubular necrosis. You lose your ability to concentrate. That's number one. Number two, I would like to copy paste Dr. Tim's talk. Thank you, sir, that you said it all on our behalf. And thirdly, I don't want to bore you with all the advice, because that's what we did for the last 3 years. Some of which you have taken and adapted, some of you threw it by the wayside. But one thing for sure, you all worked very hard, you all persevered. We all keep saying that how this COVID time was such a difficult and different time, a lot of adjustments to learning, to performing, and it was a sea change of how things are done, and you have adapted well and qualified to this wonderful profession of becoming the coolest profession there is, to be a pediatrician. And this newly minted pediatrician group, they are coming with a warranty. The Brooklyn Hospital swears that they are competent kids, they'll take care of the children across anywhere in the world. And the only thing is, we will not accept any returns. That's what I'll have Dr. Crowder talk about the residents, but also, you know, you can take shares.
I want to welcome and thank all of our graduates, all of the graduates here, the next session as well, all of our graduates' families at home and their friends at home who unfortunately couldn't be here. I'm going to make this short and sweet. We had our party last night. I gave my speech last night. I actually got a few laughs out of it, so I'm not going to try to push it too much and try to see if I can get any more laughs out of this. I do have some things written down because I don't want anybody to come up and slap me in the face during this ceremony either. So I do want to thank the Board of Directors, Ms. Fontaine, and the Board of Directors. I want to thank the hospital administration, particularly Mr. Terranoni and Dr. Vasantha Kondamudi, and then again, as well as our GME staff. Dolores Mendez, Nancy Jamie, and Dr. Armando Sarian. Without all of you, we wouldn't be able to be here and have a pediatric department or a pediatric residency, and I think that's sort of, you've held us together. I have to have a special thanks to Dr. Kondamudi, who's led us through all of these rough times of COVID and everything else we've had here. I want to thank Dr. Valentine, my associate chairman, and my associate program director, and
I got a raise.
And my PGY10, is that right now? My PGY10 chief resident, and of course our coordinators, Ms. Farnell and Ms. Hunt, who really would not be able to run the program without you guys. Again, we had a tremendously successful party last night because of that. I also want to thank the pediatric attendings who are hopefully, or some of them are watching, the pediatric nurses, our NPs, our MOAs, the Child Life Department, and the support staff, because without them, we wouldn't be able to train our residents also. And teamwork is the dream work, and they do prove that for us. And then finally, I do want to congratulate and thank all of the residents who are here, our graduating residents from the pediatric department. You've done an outstanding job the past 3 years. I know the pandemic has made things totally different than what you would have imagined most of your residency training would be, and I think you guys did really rise to the challenge. You worked diligently, with courage, and most importantly, worked as a team. And I think that really is what has made us survive this, is the fact that you guys can work as a team. You've certainly kept me busy, and you've made my job busy, I guess, and enjoyable at the same time. I also especially need to recognize the chief residents who really did have a very difficult time with all of the coverage issues and people being out and working around all of those things. All of my residents know that I do watch too much TV, and this is the one joke that I will steal from last night because I did enjoy it the most. In the past, I've been able to use canceled TV shows as my comparison for the classes, but there was really nothing that was great that was canceled this year. The only thing I could say is the return of Stranger Things, and I guess, I don't know if that's a compliment or not to my residents. But I do look at them going on from here in that sense of that they are our spin-offs, and they are going on to star in their own shows, different times, different channels, different places, and we do hope to watch and see them grow as they go on as well. So with that, with that, I'm going to call up our graduates. Dr. Nupur Asudani will go on to star as a perinatal neonatal fellow at Children's Hospital, Detroit, Michigan.
Yeah. 1, 2, 3.
Dr. Lanika Christian will go on to star as a Peds Monk fellow at Northwell, Long Island, LIJ Children's Hospital.
Congratulations.
Thank you.
Nice. 1, 2, 3.
Dr. Bridget Jahor will go on to star as a general pediatrician in the Family Health Centers in Orangeburg, South Carolina.
Congratulations.
Thank you.
1, 2, 3.
Gerline Cologne will go on to star as a GI fellow at Phoenix Hospital in Phoenix, Arizona.
Congratulations.
1, 2, 3.
Daisy Lal will go on to star as a general pediatrician at our own Children's Health Center here at Brooklyn Hospital Center.
Congratulations.
Thank you.
I like saying this one because it's sort of appropriate.
2, 3.
Christopher Lopez will go on to be a general pediatrician at Hollywood Presbyterian Hospital. It sounds so glamorous.
Congratulations.
And work with
Oh,
Horatio
sorry.
G. Lopez as well.
Beautiful. 1, 2, 3.
Utica Mondal will go on to star as a pulmonary pediatric fellow at the University of Texas Southwestern Medical Center.
Congratulations.
1, 2, 3.
Dr. Rucha Potke, our second place research
can
winner,
say
will
that.
go on to star as a pediatric endocrinology fellow at Yale School of Medicine in New Haven, Connecticut.
Congratulations.
Thank you.
1, 2, 3.
Dr. Fabiola Paul will go on to start as a general pediatrician at Advantage Care Physicians in Queens, New York.
Congratulations.
2, 1, 2, 3.
Unfortunately, Dr. Trisha Sundarajan, who I've been practicing saying her name for 3 years now, is unable to be here. She's going on to do pediatric critical care in Loma Linda University. And our last resident, Melanie Watman, will be going on to start as a general pediatrician at Divino Nino Pediatrics in Bronx, New York.
Congratulations.
So,
Sorry.
although your training has come to an end here, I hope you guys learned about being lifelong learners from us, and you'll remember that your quest for knowledge really should never end, and you should never hesitate to ask questions, and that you should never forget medicine as much as an art as it is a science. And of course, study for the boards. And remember, the one main thing that you should always remember is that no matter what, our patients are truer than anybody else's.
So presenting class of 2022 newly inducted pediatricians, right?
Thank you. Next, for the pharmacy department, Dr. Robert DiGregorio.
Good afternoon, and congratulations to not only my own graduating residents, but the other residents and fellows in the group. I promised Pratt that I would keep this short and sweet, so I will just echo again what Dr. Dim said about recognizing all of our senior administration, and Dr. Sarian, Dolores, et cetera, the board, trustees, and invite my program directors to come down and join me here. Over there. And of course, we're missing three of our program directors, one who is covering the on-call pager at the moment so the residents could be here, one that's out on maternity leave, and I'm not sure where Dr. Longo is, but probably covering clinic. So our program has been in existence now for 19 years. So it's grown to be double the size from when we started. And what has remained constant is the level of service and the scope of practice that our residents have been enabled to practice at. And I thank everyone collaboratively for allowing them to function at that level and to provide the level of service that we can. And I always like to remind the other graduating disciplines that when you move on to your next port of call, you may or may not have the type of pharmacy services that you experienced here. And if you don't, I beg you to demand those services at those respective places. Of course, we couldn't do it without the collaboration across all the disciplines here. So we are very fortunate. We have a very reputable program, and we'd like to continue that tradition. We're able to attract residents from all over the country and sometimes all over the world, but this year's class we have people that have come from places like Oklahoma and Utah and Tennessee, and Pittsburgh, and we have some local people from Brooklyn and Queens, and even some people from as far as Staten Island. In true fashion, they will also go on to various distant places around the country in their next adventure. So we'll call them up individually, and I will let you know where they're going, and just to thank them for leaving Brooklyn a little better than they found it a few years ago for some of them, or a year ago for the rest of them, and to wish them best of luck as they continue on. So let's see, did they line up in the right order? I don't think they lined up in the order of the program, but I think I see Maram up first. Okay, so Maram, come on down. Maram Sausser, graduate of Long Island University, where we are hosted today. And Maram is going to be an unrestricted free agent until after she gets married this summer.
Thank you.
And let's see, Giovanna Salmini, come on down. Giovanna, also an LIU alum, who will be continuing on as a PGY2, specializing in internal medicine, pharmacotherapy at Wyckoff Medical Center. Julia Yee came to us from the University of Oklahoma, and she will be continuing her training at the Bronx VA Hospital in infectious diseases.
1, 2, 3.
And we have Aya Gamaleldin. Aya is also a graduate of Long Island University, and she will be staying on with us to complete a second year in ambulatory care.
Thank you.
Andy Lim, who is post-call today and maybe is sleeping it off, was a St. John's alumnus. He will be continuing on for a second year in infectious diseases at Montefiore Medical Center in the Bronx. He was our chief resident as well, and that was the PGY1 class. Our second year residents in ambulatory care, I have Timothy Amin. Tim was a Rutgers graduate, and he will be, let me see if I can get this right, it's a mouthful. He'll be taking an ambulatory care position at Summit Health WellSpan in New Jersey. Next up, we have Kate Meyer. Dr. Meyer came to us from Rosalind Franklin University in Illinois, and she is currently unrestricted free agent. Next up is Joanne San. Dr. San is a St. John's graduate and will be staying in the academic realm and becoming faculty in ambulatory care at Toro College of Pharmacy.
1, 2, 3.
And next up, we have our emergency medicine PGY2s. We have Catherine Winter, which we know her as KC. She came to us from Utah, and she'll be going on to be an emergency medicine clinical pharmacist at Seattle Children's Hospital in Seattle, Washington. And our next emergency medicine resident is Jenny Lee. Dr. Lee came to us from the University of Tennessee and will be going down south to be emergency medicine clinical pharmacist at Wellstar Kennystone in Marietta, Georgia. And our next two are part of our infectious disease program. First, we have John Sorenzio. Dr. Sorenzio is an LIU graduate from Staten Island.
Congratulations.
Who completed his PGY1 with us, stayed on for PGY2 in infectious disease, and can't get enough of us, and will be staying on to do his fellowship in infectious diseases next year. And last, but certainly not least, we have Joanna DeAngelis. Joanna's from Pittsburgh and completed her PGY2 in infectious diseases with us last year and stayed on as a fellow for infectious disease this year through our affiliation with Long Island University. And Joanna is going to be working at Northwell Health Staten Island as their infectious disease specialist. Congratulations, everybody. Thank you all.
Next, for our Department of Surgery, our chair, Dr. Prat Vemulapalli.
It's always good to be the last one, right? Everyone's like, oof, how long is she going to talk? So I'm going to ask Dr. Falcone to come up, Dr. Malone, Dr. Shinato, come on all up so we can do this together. I wanted to say thank you, Dr. Rivera, because when I go home tonight, I'm going to tell my children how grateful they should be that I'm their parent and feel completely justified in doing that. But on a serious note, I want to congratulate all of you. You're all going into different specialties. different hospitals, but really to say, you know, you're beginning a wonderful, amazing career where, as Dr. Boyce said, you get to heal people's bodies, but really their souls. You're going to make extraordinary relationships with your colleagues and with your patients. So it's going to be an amazing career for each and every one of you. And as I've gotten to know all of you, you've all been extraordinary folks. I want to congratulate the faculty that taught you, our faculty who couldn't, you know, all be here because of COVID, and especially the faculty that are here. And finally, I want to congratulate all of our graduates. And I'm going to hand it over to Dr. Malone, who's going to... Oh, Dr. Donato? Oh. You see, he wanted to do the long pause, so you'd all have to watch him coming on stage. It's not on? Oh. I think you're first. Yeah.
Good afternoon. Dr. Pratt, our chair of the Department of Surgery, myself as program director, Dr. Luca Milone, our associate program director, and the new team member of our residency program, Alicia Rezabala, our new program coordinator. We all like to present to you our 2022 graduates from the Department of Surgery. I would like to congratulate them, and I would like to acknowledge their relatives, their parents, their spouses, and significant others who are watching on virtual, because you went through a lot. You went through the trials and tribulations of a surgical residency, and you made it. You are now graduates, and you will be diplomates of the American Board of Surgery. Congratulations. Our first graduate is Sean Alam. Dr. Alam graduated from the University of Delhi, and he is going to start an advanced minimally invasive bariatric surgery fellowship at the Cleveland Clinic, Florida, in Western Florida. Dr. Sarah L. Dine. Sarah graduated from the Louisiana State University in New Orleans, and she's going to join a private practice in general surgery at Northern Maine Medical Center in Fort Kent, Maine. Congratulations. Good luck. Gregory Solinski graduated from St. George University, and he's going to start an advanced minimally invasive bariatric surgery fellowship at NYU Langone in Long Island, Mignogna, New York. Congratulations.
He introduced me, it's okay. Last but not least, but it's okay. Anyway, we have 3 residents that have met all requirements set forth by the council and TVHC for graduate to here today. But before I do that, I need to express my thank you to certain people here. First of all, to the chair and the board of trustees, thank you so much for always supporting our service and our residency program. To the CEO and president, Mr. Ternoni, God bless you for the support that we received from you. And to Dr. Kandamudi, Judy McLaughlin, to the rest of the administration, thank you. To the chairs of all the departments, thank you for you and your staff for taking part in our residence education. It means a lot to us. And I also want to thank Armand, graduate medical education, Dolores, Jamie, unbelievable. My staff, they're working right now, but their unwavering commitment to making sure that we have a strong service and a strong residency program. And to my coordinator, who's been with me from the first day I arrived here, Maritza, who's been by my side and will continue to be by my side. For that, I'm thankful. I can't echo the eloquent speech of Dr. Den. God bless you. You said it so well. and I'm not going to try to. But I will add this. For all of us that are in this educational process, we take pride in making sure that all of you develop into outstanding physicians, doctors, whatever specialty. And the residency program and its curriculum allows you to do that, and we make sure of that. But there's a second part that I believe is more important, and that's a personal development. That's a maturity. That's understanding the awesome responsibility you've just been given and the privilege that you've just been given. One that deals with the health care of another human being, no matter how small or no matter how big. And that responsibility is all yours. Don't take that lightly. Don't ever take that lightly. That will be your success. And I can't echo enough for my residents during the COVID what they did. So I thank you from the bottom of my heart. Again, thank you. I will introduce them. I'm sorry, I don't know what they're doing, and I don't mean that in a bad way. But if they want to, they can say it for themselves. So first one is Dr. Joseph Carlasudo.
Congratulations.
Thank you. 1, 2, 3.
Dr. Jennifer Grezik, who served as our chief resident, great job, great leader.
Congratulations.
1, 2, 3.
And Dr. Camille Kim.
Congratulations.
Thank you. 1, 2, 3.
Congratulations, not only to my resident, but to all of you. I wish all of you nothing but success and happiness. Thank you.
In closing, just a reminder, this Saturday is our graduation/wellness event. It's going to be the New York Live After 5 cruise. It starts at 6 p.m. For those that have not responded yet or reserved the invitation, this is your time. We're up to about 265 people who are going to join us. This is an all Brooklyn Hospital event. There's no other people on the boat. In closing, I cannot thank my staff enough. Dolores, Nancy, Alexis, this would not be possible without them. 265 residents and fellows, and they help me manage it. As we close, please join me in congratulating again the graduating class of TBAC 2022.
Pictures on the side for pictures.
Outside.
Yeah, on the side.
If you want pictures outside on the left, we'll have the photographer afterwards.
He's sending me to go clean the house. D2, I-10, I will do it. Where's the cheese? Green burgers.